Welcome to a special edition of Ask Arlington. I'm Jay Warren, and joining me now to answer some important questions about wearing a mask, as we're doing here, and best practices during the COVID-19 pandemic, is Dr. Susan Bailey, who is the president of the American Medical Association. You're actually a Tarrant County resident as well, so we have the expert of the experts here with us today. And we really do appreciate you joining us, and we should point out that we're practicing what you're about to preach, which is we've got social distance here, we've got our masks on. And talk to us a little bit as a medical professional. How important is this mask during this pandemic?
Well, thanks for having me, first of all. And wearing a mask is vital to stopping this pandemic. It's really the only tool that we have right now, since we don't have treatment and don't have a vaccine. Wearing a mask, physical distancing, keeping your hands clean by either washing them frequently or using hand sanitizer. Those are the only tools that we have in our toolbox right now to fight COVID-19.
Well, the good thing is they're all three pretty easy things to do. We're not really having to stress out too much, and we can reopen as a part of this, but wearing a mask is a part of being able to reopen and do it safely, right?
Wearing a mask is really not questionable.
Right.
It's just the best thing that we can do to protect yourself, to protect others. It's really telling everyone that you care about yourself. Mm-hmm. I talk about the golden rule of masks. Yeah. Mask unto others as you would have them mask for you. And I think that's a good rule to follow.
That's an excellent rule to follow. Now, the Tarrant County order really focuses in on businesses requiring customers to wear masks. What about if you're out in public? Let's say you're at a park or you're walking down a sidewalk. Should you still have your mask on then as well?
I believe you should always have your mask with you. Optimally, have your mask on whenever you leave the house. Mm-hmm. You may feel like, well, there's nobody around. Why do I need to have a mask on? Well, you can be close to somebody before you know it, and it's best to be prepared rather than reaching in your pocket and struggling and trying to get that mask on quickly. It's better just to put it on, keep it on, get used to it. You'll be safer that way.
As an old Eagle Scout here, I love that be prepared motto, and I think that's very smart for us all, right? What are some other things? You mentioned the kind of the quick, easy rules that folks should follow that will really get us through this pandemic and hopefully save a lot of lives.
Well, first of all, stay home if you can. Not all of us are privileged enough to be able to do that. So if you have to go out, make sure you stay at least 6 feet from the other person. I like the way we're spaced up here on the stage. Keep your hands clean, either by washing them for 20 seconds, sing happy birthday twice. Use hand sanitizer, that seems to work very well, and wear a mask.
It's funny, that singing the happy birthday song is really important. You don't realize how fast you wash your hands until you start doing that, right?
Yes, thorough hand washing does take time, and it's really best to get under your fingernails and get all the little cracks in between your fingers and to really get them clean.
But the last thing that we were doing here in Arlington, we started this a couple of months ago to help with the reopening, was free testing that we're providing to folks who may have been exposed or had symptoms. How important is that testing to the process we're going through?
Widespread testing is really going to be the key to finding out who has COVID-19, who may be an asymptomatic carrier, and giving it to other people, and of course to see if you've got the disease itself. We need more testing, we need more accurate and more rapid testing, and hopefully we'll soon have tests that are available using blood testing to check for antibodies to tell whether you're immune or not, but we don't have that test yet. So the best thing that we can do now, aside from wearing a mask, washing your hands, and keeping your distance, widespread testing is a very important tool.
Last question, because I'm hearing this and reading it a lot, kind of one of those rumors that's out there. If I wear a mask, it's going to decrease my oxygen intake and somehow it's going to impact my health in a negative way. What do you say to that?
Physicians and nurses have been wearing masks for decades, and masks that are much thicker and much more occlusive than the ones that we're asking the public to wear. They wear them all day long in surgery, working hard, and never suffer any ill effects from that. It's just not possible to get carbon dioxide poisoning from breathing into a mask. You're going to get plenty of oxygen. Even if you've got respiratory conditions, wearing a mask is still very, very safe. If you have a health issue that you think it might be a problem wearing a mask, talk to your doctor and find out what's really the best way to protect yourself from this disease. But wearing a mask is safe and is not harmful at all.
Wonderful. Well, good advice. And Dr. Bailey, thank you so much for all that you're doing to spread the word about wearing masks and how we can easily help stop this pandemic and all take that personal responsibility to do it. So,
thank you.
We appreciate it very much. And thank you at home for joining us for this Ask Arlington episode. Remember, Arlington continues to offer free drive-through COVID-19 testing, and it's important that you take advantage of that if you feel like you have the symptoms or that you have been exposed to someone who does. You can always visit our website for more information on coronavirus. That's arlingtontx.gov/coronavirus for the latest information and news related to the city's response to COVID-19. We'll see you back here next time.